like when we talk about ulcers and staph infection and stuff like that, yes, all of these infections can be a bit painful. It's more painful, I think, if you're having sores. Very rarely you have sores and they're just purely itchy, because sores are like wounds, right? They're usually painful. I'm going to move towards itchy vagina, okay? Like itchy, genital area, let's say. I'm going to classify that again into two bits. One is your itchy vagina, which is the inside, right? That's your itchy vagina. And then outside is your vulva, and then you have between the thigh areas as well, which can be all itchy and really scratchy. And you go all the way back to near the bum, let's say, and that's all itchy around that area, right? So let's start off from inside the vagina, your itchiness can be anything. It can be an STI, again, your discharge, which is from gonorrhea or chlamydia or mycoplasma. Any of that can have can give you an itchy vagina. But the most commonest cause, if it's a non-STI cause, is your fungal infection, which we call thrush, or we call it candida. So that's the most commonest, fungal infection. It doesn't it can be provocated after, come out after a sexual act, but it doesn't necessarily have to be an STI. It's not an STI. So that can happen, and that can cause like a really itchy vagina on the inside, and it can also cause like a red and itchy vulva on the outside, right? And other things, commonest is, I'm going to say again, fungal infection, because people tend to have a friction, people tend to sweat a lot, and if there's a lot of discharge, and let's say there's a lot of moisture down there, and let's say some people use panty liner to absorb the moisture, which is fantastic, and if it's not, and you tend to sweat and you have your thighs rubbing and stuff, people do have a tendency to get a skin fungal infection. It is not thrush, it's not candida, it's called a tinea. It's called jocker's itch, or jockey's itch. It's a common name. It's more common among men than in women. That's why it's called jockey. So that's, again, a common fungal infection as well, which gives a lot of itch. And apart from all the infection, if any area is constantly under friction and it's constantly under some kind of moisture or a discharge which has bacteria in it, let's just say, and then sweat, again, all of this, that area will tend to become really irritated at times and really sensitive at times. You don't need to have any fungal infection or anything. It could be just your body type, So it's very important to recognize that. And like I always tell people, if that's what's happening, most of the time, the best way to do is you have to understand that your skin is sensitive down there, and you should, cotton underpants absorb a lot of moisture. Changing it more than one time a day is fantastic. If you used to need some kind of powder to, absorb that sweat or that friction, yes, you can feel free to do that on the outside. And if you don't wash it too much with soap, so that it gets dry, because some people are thinking it's so itchy, I'm sure there is something wrong, and they put a lot of soap.
They just want to clean it, yeah.
Clean it and get the germs out of it and stop the itch. But you're actually doing the opposite. When you're washing so much, you're dripping all the moisture as well. You can wash with water. Feel free to go home, take off everything that's so sweaty and hot. Wash yourself with, water. That's fine. A little bit of soap lather when you're having a body shower, that's just more than enough. And when you come out, when you're moisturizing all the other parts, just, moisturize between your thighs as well, because if you use a lot of soap, it does get dry. And so we have to keep in mind that if overwashing dries it, over wetness kind of makes it moist. So it's very important to understand your skin around that area, because it is sensitive and it is different to other parts of your, body as well. So we always tend to pay attention to the parts of the body that's exposed to other people, right? We pay so much attention to your face. You want to, you do this and that, but you don't actually pay attention to your vaginal area. So if you pay attention to you will know whether it's too sweaty or too hot, too dry. It needs a bit of moisturizer, and you can take care of it in that way. But if you have red patches and itchiness and abnormal discharge, usually like a cheesy or curdly thing, again, don't self-treat yourself and start putting, a lot of the time I get coconut oil shoved on it. Fungus loves coconut oil, and I think coconut oil is very soothing for itching. And I think that's what, because if you have itchy scalp, people tend to put oil, right? So I think that's what they're thinking about that itch as well, and they shove coconut oil on it. But I really want to say oil is such a beautiful medium for your bacteria and fungus to grow. It's full of richness, and if you're actually having an infection there, it probably temporarily soothes your itch, but it grows the fungus and stuff. So if you're having something that is not, that you did a bit of powder, cotton undies, nothing's improved, go and see a doctor to see what's going on. And if it's the fungal infection, you might need some topical creams or ointments to put on top of it. Sometimes even a tablet or two, like a clotrimazole tablet or canesten tablet, can fix it. So you have to see someone to figure that out. So that's your itchy vag with all the different bits that can happen around the vagina.